Fat or lipids, feces, qualitative. This is a qualitative test that assesses the presence of fat in the stool. A random stool specimen is obtained. Method is microscopic screen. Fat or lipids, feces, quantitative. Fat differential, feces, quantitative. This test is used to evaluate abnormal amount of fat in the stool. This test may be requested as 24-hour, 48-hour, or 72-hour stool collection for fat analysis. The patient is placed on a diet containing 50 to 150 grams of fat/day beginning at least 2 days prior to testing. Method is gravimetry or titrometry. Fatty acids, non-esteroid. Very long-chain fatty acids. Ferritin. Fetal fibronectin, cervicovaginal secretions, semi-quantitative. Fluoride. Folic acid, serum. Folic acid, RBC. These tests may be requested as serum folate, RBC folate, or red cell folate. This test is used to detect folic acid deficiency. Method is CPB radioimmunoassay, chemiluminescence, or microbiological assay. Fructose, semen. This test may be requested as levoluse analysis. A semen specimen is obtained. Method is colorimetry. Galactokinase, RBC. This test evaluates galactosemia resulting from galactokinase deficiency. Method is radioisotope. Galactose. This test is performed on blood or urine after ingestion of a galactose-rich meal. Multiple specimens may be required for a galactose tolerance test. Method is enzymatic. Galactose 1-phosphate uridyl transferase, quantitative. Screen. These tests may be requested as UDPG1P. Method is radiometric or uridine diphosphoglucose, UDPG, consumption assay. Report 82,775 when enzyme levels are measured, quantitated. Report 82,776 when screening only for the presence, qualitative analysis, of the enzyme. Galectin 3. The specimen is serum. Method is ELISA. Gammaglobulin, immunoglobulin, IgA, IgD, IgG, IgM, each. Serum is usually analyzed using RID, ELISA, nephelometry, or turbidometry. Urine uses IDE. Saliva uses RID. CSF is analyzed with RIA. Gammaglobulin, immunoglobulin, immunoglobulin subclasses, e.g., IgG1, 2, 3, or 4, each. Specimen is blood. Method is RID, ELISA, nephelometry, or turbidometry. Gases, blood, pH only. This test may be requested as blood pH. Blood pH is tested to identify acidemia or alkalemia. Method is glass pH electrode or potentiometry. Gases, blood, any combination of pH, PCO2, PO2, CO2, HCO3, including calculated O2 saturation. With O2 saturation, by direct measurement, except pulse oximetry. These tests may be requested as arterial blood gases, ABGs. Blood specimen is obtained by arterial puncture. Method is selective electrode, potentiometry, or spectrophotometry, O2 saturation. Gases, blood, O2 saturation only, by direct measurement, except pulse oximetry. This test may be requested as O2. Oxygen saturation is the percent of the oxygen in the blood that combines with hemoglobin. Blood specimen is obtained by arterial puncture. Method is spectrophotometry. Hemoglobin oxygen affinity, PO2 for 50% hemoglobin saturation with oxygen. This test may be requested as oxygen, P50 or as PO2, P50. This test is performed to measure the affinity of hemoglobin for oxygen, which allows evaluation of oxygen delivery to body tissues. Blood specimen is obtained by arterial puncture. Method is spectrophotometry or potentiometry. Gastric acid analysis includes pH if performed, each specimen. Gastric acid analysis is performed on stomach contents obtained via oral or nasogastric (NG) tube and used to measure the gastric output in both a basal and a stimulated state. Measurement of pH is included, if performed. Gastrin after secretin stimulation. Blood specimen is obtained prior to secretin injection and at 5-minute to 15-minute intervals over the next 30 to 60 minutes. Method is RIA. Gastrin. Gastrin may be measured to evaluate patients with suspected gastrinoma and Zollinger-Ellison syndrome. Method is RIA. Glucagon. Glucagon levels may be requested to evaluate suspected diabetes mellitus or glucagonoma. Method is RIA. Glucose, body fluid, other than blood. Joint fluid or CSF specimen is obtained. Method is enzymatic. Glucagon tolerance test. Glucagon tolerance test may be requested to evaluate suspected diabetes mellitus or glucagonoma. A fasting glucagon level is obtained. A high carbohydrate meal or an oral dose of glucose is given. Glucagon levels are tested at 30, 60, and 120-minute intervals. Method is RIA. Glucose, quantitative, blood, except reagent strip. This test may be requested as a fasting blood sugar, FBS. This quantitative test is used to evaluate disorders of carbohydrate metabolism. The patient has ordinarily fasted for 8 hours. Method is enzymatic. Glucose, blood, reagent strip. Blood specimen is obtained by finger stick. A drop of blood is placed on the reagent strip for a specified amount of time. When the prescribed amount of time has elapsed, the strip is blotted and the reagent strip is compared to a color chart. Method is reagent strip with visual comparison. Glucose, post-glucose dose, includes glucose. This test may also be requested as glucose, postprandial, pp. This test is used to monitor disorders of carbohydrate metabolism. The patient consumes a high carbohydrate meal or an oral glucose solution. Blood glucose levels are checked 2 hours after the meal or glucose solution. A 1-hour postprandial screen may be used to evaluate pregnant women for gestational diabetes mellitus. Method of testing varies. Glucose tolerance test, GDT, 3 specimens, includes glucose. Each additional beyond 3 specimens. These tests may be requested as GDT, oral GDT, OGTT, intravenous GDT, or IVT. A blood specimen is obtained prior to glucose administration and at intervals following glucose administration. Testing method varies. Glucose 6-phosphate dehydrogenase, G6PD, quantitative. 82,960 screen. Blood specimen is obtained by venipuncture. Method is met hemoglobin reduction, Brewer's test, modified Bishop, ultraviolet, dye reduction, or ascorbic or fluorescent spot tests. Glucose, blood by glucose monitoring device, S, cleared by the FDA specifically for home use. Blood is obtained by finger stick. Method is enzymatic, electrochemical, or spectrophotometry by small portable device designed for home glucose testing. Glucosidase, beta. Blood is specimen. It can be measured by enzymatic methods using spectrophotometry. Glutamate dehydrogenase. This test may be abbreviated as GLD or GLDH. Blood is specimen. Method is spectrophotometry. Glutamyltransferase, gamma, GGT. GGT is an enzyme. Method is RIA.